ADHD is a neurobiological condition. It is the most common behavioral condition in childhood, affecting 4 to 6% of children and adolescents. Boys are more affected than girls. They are 2 to 3 times more prevalent in boys as compared to girls. So ADHD has symptoms due to a dopamine deficiency. So we understand that dopamine is a neurotransmitter which is made in the VTA, the ventral tegmental area, and also your subconscious nigra. And it is then absorbed in the prefrontal cortex, which regulates your attention, impulse control, and your level of activity. So deficits in dopamine reception, meaning not being able to use dopamine properly in the prefrontal cortex, results in the symptoms of ADHD. So those 3 symptoms are the inability to regulate activity, which is hyperactivity. Second, inability to attend to tasks, which is inattention. And then lastly, impulsivity, or the inability to inhibit behavior. So those are the 3 symptoms of ADHD. As this is an activity on a micro-teaching activity on questioning, I'm going to use the WH questions in order to highlight the clinical criteria for ADHD. So do you remember what your WH questions are? Let's go through them. Who, what, where, when, and how. Okay? So you'll be surprised that the clinical criteria for ADHD, as described by the Diagnostic Statistical Manual, written in 2013 by the American Psychological Association, fits those 4 or 5 questions, not the WH questions. So let's begin with who. So earlier, I distributed cards, and the answers are there among the cards that you have in front of you. So you have five options from the cards that you have, and then just raise the cards if you feel that is the most appropriate answer for the questions that's being asked. Okay? Clear? Right. So the first question is who? So the diagnosis of ADHD, there is a youngest age possible. What is that age? So at what age what is the earliest age that you can diagnose ADHD? Can you please raise them? Go. Okay. So diagnosis of ADHD earliest is based on DSM-5. Sige, the royals have a problem. You guys right? So okay, the answer is 4. So the second class and the merchant class got it correctly, and the first 2, no? So based on the current DSM-5 criteria, the youngest age that you can diagnose ADHD is 4 years old. Okay? And the symptoms that you can diagnose it at a much later age. However, the symptoms must be present before a certain age. Now, this is the cutoff. Now, you must have these symptoms before this particular age. What is that age? That's the second part of that question. Can you please raise your answers? Okay. So the one who got it correctly is the merchant class, no? Queen, 12. No, so again, when it comes to the diagnosis of ADHD, the youngest diagnosis is 4, and then you must have the symptoms before the age of 12. Okay? Next, that's a question for whom. Next is how many. Okay? So the symptoms, so in the DSM, you notice that there are 9, if you remember correctly. Some of you may have read them when you were going through your 3rd year. Okay? So there are 9. So for you to be able to get the diagnosis, how many of the 9 should you have as a child? Okay, can you please raise your answers? How many out of 9? Raise them. Good. Okay, clergy? Raise. Okay, so the answer is 6. Okay, so 6. However, for those who are 17 and onwards, so 17 and adults, there is another criteria. How many out of 9? Can you please raise? Okay, the royals have it. Okay, merchant has it. Okay. Okay, so congratulations to royals and merchants. So they got it 5. Okay, so in children, it's 6 out of 9. In 17 and older, it's 5 out of 9. Okay, of either or both inattentive and hyperactive impulsive symptoms. Let's now go to when. Okay, so any diagnosis in DSM has a temporal criteria. You must have these symptoms for at least an X amount of time. Okay, otherwise it can be considered something else. So how many months should a child or adult have it before you can say that this person has ADHD? Okay, how many months? Raise your cards. Okay. No. So everybody got it right except for the clergy. It's all 6. Okay, 6 months of symptoms. And then last question for that part is how many settings? Because if it's only understand that behaviors are permissive. Okay? Meaning, when you say permissive, it is in most settings. It's not just in one exclusive setting. So how many settings do you need for you to say that this child has ADHD? Can you please raise? Okay? So 3 out of 4 got it. No? So 1, 2, 3, it's 2. Okay? So it's 2 settings. So in children, it's most likely, which are the 2 settings that's common in children? Home and school. Exactly. Okay? So those are the who, how many, when, and where. So the what in ADHD are your symptoms. No? But there is a very important caveat in DSM-5, no? That there must be clear evidence that the symptoms interfere with or reduce the quality of social, academic, and occupational functioning. Because if you go through the symptoms of ADHD, we all can relate to them. Diba? Short attention span, fidgety, squirmy, but so long as we are able to perform, no, it is not a disorder. Okay? So that's one of the important criteria here for DSM-5. And also, the last part here is the exclusion criteria. It must not be seen in the course of schizophrenia or other psychiatric disorders, or better not explained by other mental health disorders, including mood disorders and anxiety disorders. So if you are familiar with DSM-5, this is what you're going to see. You see 9 on one side and 9 on the other side. The right side is symptoms of inattention, the left side are symptoms of hyperactivity and impulsivity. So if you go through them, I've underlined the salient parts of each statement. So for inattention, often fails to give close attention or detail and makes mistakes. Okay? So I'll just go them very quickly. Makes mistakes, has difficulty sustaining attention, does not seem to listen, does not follow through on instructions, often has difficulty organizing, often avoids or dislikes or reluctant to engage in tasks that sustain mental effort, often loses things, is easily distracted, and is often forgetful in daily activities. Are there any terms there which are difficult or that I need to be explained, or perhaps you can explain yourselves? Pretty much self-explanatory. Okay. Now let's now go through the hyperactive impulsive symptoms. No? So these are the 9. Okay? So they include fidgeting or squirming, often leaves the seat, often climbs or runs in situations where it is inappropriate, often unable to play or engage in leisurely quality activities, is often on the go, talks excessively, okay, often blurts out answers before the question has been completed, has difficulty waiting their turn, and often interrupts or intrudes on others. So maybe you're relating so much to these symptoms of hyperactivity. So can I ask you, what do you mean by fidgety? So tell me what do you understand by, or how do you, what do you mean by fidgety in this context? Okay, can somebody answer? What is fidgety? Fidgety is when you, that's right, when the hands are moving, okay? How about squirmy? What do you mean by squirmy? Exactly, no? So sometimes I'm glad that you demonstrated, because sometimes the words are inadequate, no? When it comes to behaviors, it's best when it's demonstrated, no? Okay, so that is what is the meaning of fidgety and squirmy. Okay, again, in children, how many out of 9? In 17 and older?
5.
Right. Okay, so let's go through them. Again, we're talking about one of the 4 A's, no, as mentioned by Brock in 2007, which were significant, which is ADHD, attention deficit hyperactivity disorder. And the answers are as follows. No? The diagnosis is at, the youngest is 4 years old. The symptoms must be before the age of 12. You must have 6 out of 9 as a child, or 5 out of 9, 17 and onwards. It must be present for at least 6 months and seen in 2 settings. So these are the diagnostic criteria for attention deficit hyperactivity disorder as described by DSM-5 published in 2013. Thank you for your attention.